Hello, everyone, and welcome to Healthwatch live session. My name's Anna Marie, and we are here today to talk about prostate cancer awareness. I'd like to welcome Alison Chapman, who's our guest speaker today, and I will hand over to Alison shortly, and she will tell us more about prostate cancer, the symptoms, diagnosis, and treatment. To start off, I'll just go to some introductory slides. Just some guidelines for the live stream today. Be accepting, respect boundaries, don't be rude, don't flood the chat, don't self-promote, and please keep it clean. We welcome any comments or questions, just add them to our Facebook page, and we'll try and get them answered. So the session overview today, I'm just talking to Healthwatch and the introduction to the session, and I will shortly hand over to our guest speaker. We talk about prostate cancer rather than breast cancer, like it says on the slide. And at the end, we've got a couple of questions from the members of the public. So who's Healthwatch Bury? Healthwatch is your health and social care champion. We make sure NHS leaders and other decision makers hear your voice and use your feedback to improve care. We listen to your experiences of using health and social care services and share them with those with the power to make the change happen. And we can also provide you with information and advice. We can also support you by signposting you to local groups, providing you with information and advice about you and your family members' care. And our contact details. I will now stop sharing this presentation, and I will hand over to our guest speaker, Alison. Can you see that presentation, Alison?
Yeah, I can. Thank you.
Brilliant.
Okay. Thanks, Anne-Marie. As Anne-Marie said, I'm Alison Chapman. I'm Cancer Care Coordinator. I work for Horizon PCN, so work across the Bury area. And a lot of my job is encouraging people to be more aware and alert to changes in the body, to get checked out by a doctor or a clinician, and more so to also not ignore any kind of symptoms. I'm going to go into that in some detail as well. So if you could go to the next slide, please, Anne-Marie. So prostate cancer is one of the 4 most common cancers in men. That is the case across Bury. The most common cancers in Bury are breast cancer, bowel cancer, lung cancer, and prostate cancer. Although prostate cancer affects 1 in 8 men in the UK, it's normally a cancer that is very treatable. That's because it tends to be quite slow growing. Okay, next slide, please. So what are the risks of prostate cancer? As I said before, it is 1 in 8 men. However, it does reduce to 1 in 4 men if you are of a Black or ethnic origin. They don't quite know why this is the case. However, it very much is. So obviously, if you are Black or ethnic origin, you do need to be more aware of the symptoms that I'm going to discuss with you today. Next slide, please, Anne-Marie. Okay, so calculate your risk. So you can do this in 30 seconds, and it literally is 30 seconds. I've gone through the checker myself. So the black box at the bottom of the screen there takes you to a risk assessment tool. It will evaluate what your risks are of getting prostate cancer. It asks you to enter information, and this is through the Prostate Cancer UK website. It will ask some details such as your age, your ethnic origin, your family information and history. So if anybody in your family has had prostate cancer, so grandparents, parents, and then it will work out your risk. And as I said, it can be as quick as 30 seconds. It's very, very worthwhile doing this and just assessing what your risks are. Okay, next slide. So what happens if you are at risk? So if you've done the risk calculator and it tells you that you are at risk of getting prostate cancer. It doesn't always come with any symptoms. Most likely that you will have symptoms, but it doesn't always happen like that. It's not always the case. So if you complete the risk assessment tool and you are at risk, then you should always speak to your doctor. When you speak to your doctor, you're most likely to be asked to complete a questionnaire about your urinary symptoms. So this will be things like, how often do you get up to go to the toilet during the night? Do you ever have to go urgently to the toilet? And lots of other questions that the doctor will ask you. The doctor is most likely then to ask you to have a blood test that the nurse will do. It's just a simple blood test from your arm, and it will check something called PSA, and that's an abbreviation for prostate specific antigen. If the blood test indicates that your PSA is high, then you may be asked to go and see the doctor for a quick examination. I know a lot of people will try and maybe shy away from that. But what you need to remember is that the doctor examines patients every single day, and it is a really quick examination. Next slide, please, Anne-Marie. So what are the symptoms? I did just touch on some of the symptoms there. And I did say that it doesn't always have symptoms with it. So we do get diagnosis where patients haven't had any symptoms at all. So first of all, do the risk checker assessment that I've just shown you. Basically, any changes that happen to your body when you go for a wee or to empty your bladder can indicate prostate cancer. It's really important that any toilet changes aren't ignored. They can be part of getting older, but it can also be a sign of cancer. So any changes that happen when you go to the toilet, so if it becomes painful to wee, any blood in your wee, even if it's just slightly pink, that can indicate blood. So get that checked out. Any changes to your flow. So for example, if you usually go and you've got quite a strong flow of urine, and then that changes, or the flow starts strong and becomes weaker, any starting and stopping when you're having a wee, anything like that can indicate that it might be a symptom. So having to go back to the bathroom as well, that's also a symptom. So you feel like you've been to the toilet and you've emptied your bladder, and then a few minutes later, you suddenly have the need to go again. So obviously your bladder may not have been fully empty. Needing to use the toilet more during the night. And this can be age-related, and we know that. However, more frequency during the night in particular can be a symptom. A sudden need to use the toilet, dribbling urine after you've finished, a sudden need to go, sorry, I've repeated that, but sometimes leaking before you get there, and difficulty starting to go to the toilet. They're all the symptoms that you need to be aware of and looking out for. Next slide, please. So we're going to listen to a nurse who's just going to give an overview as to a bit of advice and information further to what I've just said about prostate cancer. If you're okay to play that, Anne-Marie.
Thank you.
Got no sound on that, sorry.
Say it again, sorry.
There was no sound on that.
No sound. I can hear the sound from my laptop, so I might be best just adding the video link in the comments under the video if that's okay.
Yep, that's
and sharing it
fine.
on our YouTube channel as well.
Yep, that's great.
Sorry about that.
No, don't worry, it's fine.
So I think we're up to over here, weren't we?
Yeah.
There we go.
Okay. So, as I said before, anything new for you needs to be checked out. So, a lot of men in particular seem to try and resist going to the doctors or getting any advice or support or information. Please don't do that. It's really, if you take away one thing of today, please don't ignore anything that's new for you, anywhere throughout the body. Remember that anything new needs to be checked by a doctor. Don't put it off. Your doctor wants to see you. I think because females have more screening programs, we tend to be a little more eager to get anything new checked out. But men can go years and years without seeing a doctor. Don't let that be the case. If it is something new, then your doctor does want to see you. And if you mention that you're worried about your prostate, you want to get things checked, then you will get booked in at the doctor. Don't try and just put it off and think it'll go away. Don't try and ignore it. Don't normalize it. Anything that's new needs to be checked. So most referrals for cancer, and this is part of my job as well, most referrals for cancer are actually fine. I would say I probably see about 90% of referrals that are sent through for possible cancer. They don't come out as being cancer, and they're just reassured. So even if it just takes that concern out of your mind, and it's no longer keeping you awake at night, then it's worth it. And obviously, if it does happen to be cancer, then the earlier that it's found, the more treatable it is, which is what we want. We want lots of patients who are unfortunately given a diagnosis for that diagnosis to be at an early stage. It's far more treatable. They may just monitor you. They may just keep an eye on the bloods, give you scans. They may just want to keep an eye on things. But as I say, the chances are that cancer is very unlikely. But please don't ignore anything new. I'd like to thank you for taking the time to listen today. And I know that Anne-Marie's got some questions. If you've got any further questions that you want to ask, then I'm more than happy to answer that.
Oh, thanks very much for that. And thanks for sharing the information. It's been really helpful. And as we know, March is also Prostate Cancer Awareness Month as well. So it kind of fits well with the timings. I do have some questions, if that's okay. So the first question that we've received, are there any specific lifestyle changes that can improve outcomes or quality of life for men?
Yeah, so I would say to reduce your weight and to get that within a healthy range. So a lot of people are carrying excess weight. That's going to increase your chances of cancer. I would suggest making sure that your diet is healthy, making sure you're having lots of fruit and vegetables in the diet. Try and reduce your red meat intake. Monitor your dairy products as well. So try and keep that low fat. Remember, it is really children that need full fat products in the dairy section. Try and become smoke free. Monitor your alcohol intake as well, just to try and eliminate chances of getting cancer. If you think about, I always think about cancer as being a bit of a Russian roulette with a gun. So you've got one bullet in a gun, and you sort of spin that barrel round. Anybody could get cancer. But if you try and make your lifestyle as healthy as possible, make your body as healthy as possible, then it does reduce that chance. It doesn't eliminate it, but it does reduce it. And I think don't mess with if you can alter one thing, don't mess with that barrel spinning round. Just try and control the things that you're able to. So healthy weight, healthy diet, regular exercise, smoke free, quit smoking, monitor your alcohol, and just to keep as healthy as you can.
Thank you. That's really helpful advice. Are there any support resources available for patients and the families of men who have been diagnosed with prostate cancer, or who may suspect that they have some symptoms and they just want to get some more information?
Yeah, absolutely. Your doctors will always have leaflets and information sources for you to take away with you. That's always good because you can take it home and just read it at your leisure. There's lots of websites that you can go on to get information and support. So Prostate Cancer UK is a good one. And I would also recommend going to cancer support service centres. So in Bury, we've got Bury Cancer Support Centre. These centres aren't just for patients, so the patient, but also for the patient's family. So any concerns that you have, if you're just wanting to talk to somebody about your concerns, or if you're worried if somebody's given a cancer diagnosis and your partner or your friends, family want that support, they can always access these cancer centres where you will get a lot of support and you will always be welcome. So don't sit there and worry about it, is what I'm advising.
Oh, thank you. I'll also include the details for the Bury Cancer Support Centre in the comments as well, so people can easily access it if they should need any further help.
Thanks.
So the next question that's we've had a couple of inquiries about recently, how often should PSA levels be monitored after treatment?
Okay, so if somebody's been given a cancer diagnosis, they will automatically be under the care of the hospital. They will have a urology nurse. They're monitored very, very closely anyway. So if they've had a cancer diagnosis, they've had some treatment, they're normally checked regularly, particularly for their PSA. So initially, and it does vary from area to area, but initially they'll probably be checked every 3 months with their PSA, so have a blood test every 3 months. After some time, it will then be lengthened. So you might be called to have your PSA done every 6 months. And then over time, it will reduce to every year. They will also receive scans at the hospital as well that will have a look at the prostate. So if you do get a diagnosis, you'll be very, very closely monitored. But any concerns, get that PSA checked and speak to your doctor.
Thank you. And can anybody, if you do go to the doctor with the symptoms, can you ask for a PSA test from your GP?
Of course, yeah. They may check if you say that you've had a risk assessment on the Prostate Cancer UK website and it's
Mm.
advised you that you are at risk, your GP surgery will always ask you some questions. But if you've done that risk checker, they should complete the blood test for you. It's really important that you do that and you inform the doctor's surgery that you've done the PSA checker.
Oh, thank you. Great. And the last question that we received, what are the signs of reoccurrence and how is it detected? Or
Okay.
anything to look out for?
Yep. So recurrence with any cancer is unfortunately quite likely on occasions, and it can come back. It's never something that if you've had cancer, you're then free and you're going to be cancer free and it's not going to come back. That's not the case, unfortunately. It can be quite common that it does come back, but not always, and nothing to sort of overly worry about. The chances of it coming back would usually be that you've got urinary symptoms. So all those toilet symptoms that I indicated before. So the need to go to the toilet, dribbling after you've finished going to the toilet, any urgency, more frequency during the night, feeling that you've finished having a wee and then suddenly you need to go back. So those are the main symptoms you need to look out for that can indicate the cancer coming back. Also, if the cancer, it can unfortunately spread outside of the prostate. The most common places that it may spread to are the lymph nodes and the bones. So again, going back to what I was saying before about anything that's new for you, that you get it checked. So bone pain, so new aches, pains, discomfort may indicate that it's come back. It's not always the case, thankfully, and that's not something that happens terribly often at all, but it can happen. So just be aware and mindful of that. But as I say, anything that's new for you, please do get it checked.
Oh, thank you for that information, and thanks for sharing the symptoms, treatment, and diagnosis information as well. It's been really helpful, and I think it's just good for to raise awareness as much as possible. Just before we finish, just want to mention as well, we are due to do some work around prostate cancer later on this year. So if anybody's watching and wants to find out more information, please do get in touch, or just watch out for our information on social media and website. It's due to start hopefully in August, September time, but just want to let people know. But yeah, thanks very much, Alison. Really appreciate the information.
Thank you. Thanks for your time.
Thanks a lot.
Thank you. Bye-bye.
Bye.